told you there's a day people spray the whole month, right? Sorry. I hope I won't be arrested for this. But it's because, unapata, it reaches somewhere where I have to defend myself in some weird ways because there are multiple abuses that are happening. And what pains me is that the public is not ready to call it out. Because the day I'm telling you I was in a mat and something like that happened to me, and the person who did that is someone old enough to be like my dad, and the women and men sat next in the mats. They were not remorseful.
So it's a good thing you perspect them.
Actually, that's why. That's what I did because I wasn't planning to do that, and the reason even why I got a paper spray is because I was afraid. After watching your podcast, I wasn't even able to finish in a one sitting because you get triggered because this is not something. Because no wonder. Yes, I was telling you, I've been abused a couple of times and harassed, and I'm like, yo, now people are getting killed. I'm not special. I was good somewhere I get killed. I think after watching your podcast, after 30 minutes, I was like, you know what? I'm triggered enough. Maybe go recuperate, then come watch again. Because it's real and it's here and it's with us. So it's about time that we educate ourselves. We
are a bunch of junior medical officers based out of Nairobi, Kenya, who are trying to talk everything healthcare in this country. From medical conditions, medical innovations, lifestyle of healthcare workers, behind the scenes and more.
That's true.
Yeah. Continue. Let me finish introducing the channel.
Right.
So please follow us on our socials, like, share, subscribe. Give us any feedback that you can give us. We appreciate all kinds of feedbacks on improvement, and also if you have any questions and any conditions you'd like us to talk about, just drop them down in the comments. Yes, today's episode we will be having someone in studio with us, a friend, a guest, a young member of the community based out of
East Lando.
Yeah.
Introduce yourself.
Introduce yourself, please.
Okay.
Yeah.
I thank you for this platform. So my name is Frida Nduati. Where should I start?
You're very humble. Her name is Dr. Frida Nduati. She's the youngest board member holding a public office in Nairobi County. Hospital board member.
Yes.
At Mama Lucy Hospital. She's also a doctor as well. Yeah.
An OG gangster.
And she's making very huge strides in our community in terms of improving the lives of people around you and having an impact on the lives of people around you.
Fighting for the people who don't have a say as well.
Yes.
Yeah.
So introduction from our right, we start.
My name is Dr. Muhyiddin. You know me, Dr. Mo.
Handsome doctor.
I'm Dr. Dimble.
Yeah.
Welcome to Laughing Lab Coats. We thank you very much for the reception we got in the last episode.
Ooh.
Yeah, it was good.
It was really nice. Yeah, I liked the feedbacks. The feedbacks over there are very nice.
Keep them coming. Continue watching our pod. If you have anything you would like us to discuss in the pod, please feel free to share in the comments.
Yeah, check us out on Spotify as well.
Yes, or even Apple Podcast. Yeah, even all streaming platforms. At a Boomplay unatupata. At Kosekani, like our aim is to create like a community that is aware about their health, not in only one aspect but in all aspects.
The fact that our audience is ages of 18 to 35 makes good potential of the number of people who will be self-aware about health.
In your clinics, I think the age group that is mostly our audience, 18 to 35, are people who, when they come to the clinic, they have either Googled their symptoms or they are not, like, the majority of us are never in chronic conditions that you need to be aware of it all the time. Yeah. And these people do not have like a community support. Like probably you're struggling from this and you want to share it out. You want to have people who have the same experiences as you, but you do not have that community. So that is one thing we're also trying to create, whereby I have a certain condition. I'm in a community of people who have a certain condition. And we discuss the challenges that we each go through, how we are relating. We do not have that in Kenya. So that is what we are aiming to create.
And something might I add that other than that, I think as a recipient of this podcast, also is a platform for conversations. Because especially when you're saying that the last, which is true, the last podcast got a little bit of buzz, is because it sparked a conversation. And I think that's what we need. Okay, with the age what?
Age group that we are in.
Age group that we're aiming, I'm one that is reaching this podcast is reaching. Yeah, I think it's the age where as you see, it's young people, right? And I think with how the generation imekuwa is that people don't want, we are coming from some traditional ways of doing things where we are told what to do because it's how it's done. And I think having this platform, it will spike conversations to show people it's a platform where now people will understand why things are done the way they are being done, and also spike conversations to see if there are better ways of doing other things. So yeah, I'm glad that you guys
we're doing what we're doing. And hopefully we can do it more.
Yeah.
You know, she has always been behind the scenes from day one when we were starting.
When this thing was a dream.
Yeah, just a dream.
Plastic.
Yeah, thank you for coming here, Badhi. Thank you for taking your time to be here, pamoja.
And thank you for inviting me. I say, I'm glad that you're my friend.
We're happy that you're our friend.
Yeah.
Now let's get down to brass tacks.
This topic we'll be looking at our previous episode in now a different point of view. Majority of our community members were talking about having majority of our community members are talking about having a female point of view of this, because we are a voice as well, and we haven't given the opportunity to the actual gender of being affected, someone to actually talk about it from their point of view. You know, we're also going to be talking about the accident that happened at Embakasi and its impact now on our side. It's not good that we start blame gaming, like what has happened, who did this, who didn't do this. But let's talk about the impact first. Let's deal with the impact, the people who got affected. Then we will look at the other things later. And one of the ways it has impacted people is health-wise, because there's been a lot of burns, people, some other injuries, trauma patients. Traumas happened to many people. And these people have now been imposed on a health bill which they had never ever prepared for.
They were not ready for.
They were not ready for. I will have an accident today. Let me keep this money here, and go pay this to the hospital. So we also want to discuss healthcare financing in Kenya in a bit, in like very very lay terms.
We should start with the femicide bit. Recently, I think there was a few other new cases that came up.
Since we talked about it,
Yeah.
It's even after we shot the previous episode, like there are a few others which popped up. And what does it feel like? Like
as a Kenyan woman in Nairobi, with what's happening, how do you feel, and what's your point of view?
Where do I even start? What I can say, frankly, and I'll be vulnerable at this point, we are scared. And I think Elias, I've shared with you a couple of times, where it's not really a shock, but for such a disaster to hit our country, it didn't start from just women being killed. It starts from very simple and mundane things, like women not being heard, women not being demoralized, women being seen that how far, I'm being discriminated in places that they shouldn't be. It stems from a lot of things, and I think it is that kind of dehumanization of women that now comes to genocide. Not genocide, sorry. Femicide. And
it feels like a genocide.
It feels like a genocide. Because I think the awareness that there's a rally that Kenyans came together, right, to spread the awareness of femicide. And I was just, I wasn't able to attend any of them, but I think that's what it has done. It has brought to limelight what women actually, one of the worst fears of women. And I think, Elias, I've shared with you a couple of times, as a woman, as a young woman in Kenya, there are times I'm even afraid of going out. There are times, and it's because it starts, it starts with abuse, where people feel like they have the rights, because they're men, they have the right to do something to you. And I can say, I can even give multiple stories of how I've just left the house. Maybe I'm in a mart, and sina story, and just at the mart, imetulia tu. Then unapata someone just comes and this is funny, right? Let me just give you one story to make a point. So this particular day, I left home. I was going to town to do some errands, then come back. I'm quite small. I'm not big. And it's okay. Mumbile, sindio? Wajua leo nimesikia ati urefu na ufupi, ni mumbile. Mimba na kitambi ni bigi yako. So hii ni mumbile, right? And unapata, I'll try to be, so when someone wants to group me, they have to dig deep. Because they're not there. What to be grouped is not at the surface, right? And you see people go to the extent of they're not even afraid. And what pains me, I told you there's a day people spray the whole mud, right? Sorry, I hope I won't be arrested for this, but it's because unapata, it reaches somewhere where I have to defend myself in some weird ways, because there are multiple abuses that are happening and what pains me is that the public is not ready to call it out. Because the day I'm telling you I was in a mat and something like that happened to me, and the person who did that is someone old enough to be like my dad, and the women and men sat next in the mats. They were not remorseful.
It's a good thing you pepper sprayed the whole mat.
Actually, that's why. That's what I did, because I wasn't planning to do that, and the reason even why I got a pepper spray is because I was afraid, because it has happened multiple times, and unapata the community has really given it a pass. The time something happened to me and I went to someone who was next. It was a lady and a man, a lady and now another man, and I told them, yo, this and this has happened to me. Mtu sijui shida yake ni gani. And niambia wewe na wewe mbona ulikaa hapo? Blaming the victim.
Wanangesimama na conductor.
Blaming the victim than
addressing
the issue, and even
that.
the person who is doing that. So napata, for us to reach to a point of femicide, it's something that has been growing, and it's something that has been in our country for quite some time.
It's been piling up.
It has been piling up. Now, ukiangalia even in our government systems, I think I will come back to when these women who have been in power. I'm not been trying to be political, but look at these women who came in power, and when you see, and if you look at it intricately, there have been a process for them even to be where they were. But you find these women will be slashed with more of, say, the morality will be questioned, alifanya kitu ndio apate. It's not that this woman has worked themselves up to that space. So but such discrimination, stereotypes, it dehumanizes a woman, na tunarudi to some centuries zenye tulitoka kitambo. So yes, we are making strides in other things, but nadhani it's time that tukue aware. Now we women as people also, so that we don't have this kind of killings, and they're very young women, and we can say that. And something that I've been hearing, where that these women were killed because they were looking for money, so let's say you're talking about the 22-year-old who went to someone's house, right? How do we explain the woman who was killed in her kitchen making ugali? So every time, if there's a reason, there'll always be a reason of why
people will find a reason.
So that means there's no reason for killing. And we shouldn't, like, that should not be, the question should not be these young women are doing this. This is why they were killed, you know. It's more of let's educate our men and let's live in harmony, man. Because it's such a scary world. What I'd say is I'm actually really frightened. And I told you, I think I told the both of you, after watching your podcast, I wasn't even able to finish in a one sitting. Because you get triggered. Because this is not something, because no wonder. Yes, I was telling you, I've been abused a couple of times and harassed. And I'm like, yo, now people are getting killed. I'm not special. You know, I'm supposed to never get killed. I think after watching your podcast, after 30 minutes, I was like, you know what? I'm triggered enough. Maybe go recuperate, then come watch again. Because it's real and it's here and it's with us. So it's about time that we educate ourselves. We educate ourselves.
Is Macheki during that rally? It was in town.
Yeah, bro.
There are two guys who were recorded. I don't know if you saw
Yeah, the ones who were pizzas.
Did you see it?
Yeah, I did.
So openly in front of the camera.
You didn't see?
To make
I
it
saw
worse,
it.
that guy, there was one end of the rally, he was recorded, he saw a stupid conversation. And then the people who shot that video ditched that area, akaonekana in another video coming to say tumekuja kumaliza.
Like he's seriously acting on it.
He is dead serious about it.
And that's like an image of some part of the men in our society.
And
That they
it's-
actually believe that they have dominion over their women and they can go as far as state that they will kill them in front of camera. Just violently proud of what you're doing as a man, which is shitty. We should be the protectors of our women. But on the other hand, we have such images, which is not a good image for the men in our country.
It's sad. Really sad.
Who does it come down to though? Like, we did the psychology bit of it, and to say that hakuna mtu amezaliwa ni
Murderer.
muuaji, yes. It's something that is going on wrong, like, amongst us men that we have not really fully addressed.
I think I'm not a man, though. I think I'd say something. We all come from different backgrounds, right? And as doctors, we know how some traumas can kind of wire someone thinking a certain way. Though one of the things that I've seen is dominant is that men don't call out each other. You know, let's say you found the bill doing some weird shit. Not that you do weird shit. But umempata. And I'm speaking out of experience. That's men. I'm not trashing. I hope I'm not. I don't want people to come at me for this. But I've been in places where, where when a man does something, they don't call out each other. And I think educating each other. You know, you know that is not right. Why are you allowing your fellow person go through that? Let me give an example. Kunyamaziana. The time I was in a mat and some girl was being caressed in a weird way. You know, when to me flock. And I started asking the lady, "Are you okay?" And I said, "No," but she couldn't move. I was with a guy, a friend of mine, and I was like, so I started pulling her. This man touched my hand and showed me. I said, "Say I'm small." So did her. Itarusha. So this guy I'm with, I was expecting, you know, he's stronger. He can do that. But so no one be, yo, bro, see,
You do something.
He shouldn't even mention it. If he sees you being manhandled, he should intervene.
Exactly. And I was even saying for the lady, he did nothing. So after we left, I asked him, why didn't you ask me in Husu? Okay, let's just say I ditched him. Pia
I guess you pali inakuja from yeye haimhusu huyo dem akigropio, but for you inamhusu wewe ukisukumwa.
So players inafaa kumhusu pia kigrupiwa na another one.
Inafai kumhusu, but unajua there's a dynamic to that. Wewe unaonaje? Inafai kukuhusu ukiona msichana akigropio kwa 3.
Comma 3, and she is very uncomfortable and she cannot say it.
If you can see the fright in her face,
You have to address it.
But if you're nice,
Yeah.
Jipe
But you have to have like
Because what
Why
happens?
is it calling out?
dynamic.
No. Let me tell you. You see, there's a placard that I saw during the awareness. Nilikuwa nasema she might be your sister, she might be your mother, she might be your
yeah.
auntie.
Remove all that.
It was removed. She is a woman, and she's a person who should not be abused and should not be killed.
Yeah.
So it's not about if you know them, if you don't know them. Ni humanizing that person and seeing that, like that what she's going through is wrong, and standing up for that.
that is behind the gender curtain.
Yeah.
She is a human first.
And it should be everybody's
Duty
duty to do that.
to correct a person.
Because if you don't speak, you're actually appropriating the behavior.
Unakubali kuwa it's right to do that. So you should intervene as soon as you see it.
You're part of the oppressor, basically.
You're affirming the oppressor.
Thank you. That was very deep, and also thank you for being vulnerable about it and how you've been feeling through this period. Hopefully, I think maybe a solution to this comes up as fast as possible.
I think what we can do is let's continue having this conversation. It's in January.
Okay.
Let's continue having this conversation. Not in this platform. I'm saying in our homes.
In our offices, in our homes,
and
in the matriz.
Workspaces.
Yes, and
in hospitals.
Yeah, in our hospitals too.
Yeah.
So that
There are so many women who are
Taken advantage of. Or,
taken advantage of. Like, you're qualified. Umekuwa daktari. You just want a job. But someone sees, looks at you, says, she's fine.
Which shouldn't be.
Shouldn't be.
If she's smart enough to have gotten there and she's qualified for the job,
To make it worse is, you notice, I don't know if about the numbers and statistics of how many women are employed. I don't know that. But most employers as well, they kind of are moving away from women in sectors which it's okay to have both genders. I'll give you a good example. Women are generally expected to have the following: 1, pregnancies, delivery times. So the time that I'm talking about private industries mostly, the time that they get employed, the employer will have to think, hapa nitalipa maternity leave. 6 weeks or a few, sometime too. So that for them is a penny imekuwa pinched. But in real sense, it's not a reason ya limit mtu ambaye who is qualified to do that for you. Kila mtu anafinya mapeni yake, anasema we are not going for women because we will pay extra in a way. That's 1. 2, I think ideology, most employers in terms of accepting women into their facilities is the like hard work that is needed. Kuna mademu pick a job, like they're good for it, 36 hours, 72 hours, someone is still up and they're moving. Internship was a good training experience, and you'd find a lady doctor with you in theater. Kwa hapo na yeye. So I think the majority of things women go through in this country is, if we said we would sit and talk about it, it will never end. But I think it's time and for men to start thinking that it's not just about us, it's not just about how vulnerable women can be. They're part of the society and that they need their mentality and the things they do are needed. Women by the age of 26 think almost are way smarter than a boy who is 26.
So you're calling us boys? Because I'm around 26.
No, just
around.
I'm just saying. A boy who is 18 and a girl who is 18 do not think the same.
Yeah.
Do not think the same.
And you find, just to add to your point, all those things that are kind of discriminating women in places of work, I don't know why people see it as the opposite of strength is weakness. I don't know why people see it as weakness, yet that's part of the strength that women have. For example, as you said, like women will take you bumper to bumper, right?
Yeah.
And I think I can I can say you've worked with these guys, and I'd say, what can you say when we work together? How are we complementing each other? With me being a woman and you being a man.
How my relationship with my female workmates.
Yes.
It's been efficient. Remember, I've had the privilege to be taught by two outstanding female surgeons, one in Uganda, one in Kenya.
Shout out.
Yeah, Dr. Frida, shout out, and Dr. Vivian. Unapata. And honestly, it was one of my best experiences, because even obstetrics, pediatrics, all the people who were mentoring me in like the medical field in those aspects are women. Unapata. And I had one of the best times there. So my experience has always been positive. They're brilliant people, hardworking people, and they're detailed.
That's what I was going for.
Detailed.
Because you find, okay, I had asked you a question, but let me just answer the question.
Mm-hmm.
You find we have our strengths, and what I'd say is it's not a competition between men and women. It's a complementary. You know, like there with me and the nature of me being a woman, there are things that at my age, because of actually my gender, I have been nurtured into. You as a man, the same. And you find that when there's coercion, a lot can happen, really. Like, there's a lot that happens. And great things happen, actually.
When there is cohesion, great things happen.
I can give an example with where we trained.
Mm-hmm.
Did you see how the surgeons, we had a female surgeon and a
male surgeon.
And when there's cohesion,
yes, everything was flowing
smoothly.
Yeah.
And I think that instead of seeing each other as competition, how can you complement each other?
Guys, I think that is the takeaway home message. Like, it's not a competition, it's a coalition. Yeah.
Let's get together and be alright.
One love.
So today on to like our topic of the day. We're going to be discussing this in a point of view, looking at the Embakasi incident. Unfortunately, it's an unfortunate event. But that's the bad thing about emergencies. You're never prepared for them. You're never planned for them. It's an accident.
Yeah.
Now, at this point, we are sending condolences to the families of the affected people, and we're wishing a quick recovery to the people in hospitals. Some of them who are taken for recovery and treatment at the hospital which you are a public member of, and you're a representation of that hospital. How do these people go about paying their bills? That is one question that is always going to be there. And we have to look at the model of probably some of them are people who never had insurances or people who do not have money right there and then, but are now being faced with a hospital bill, medications bill, and recovery post, because it's going to be a long road to recovery for some of them.
And disability.
Long-lasting effects. Yeah. And the thing is, who is going to pay for that? Because these people are most probably chilling in their houses. Unabangaiza tu, unawatch game.
What makes it worse is if you look at the location where that thing happened, and the entire area is surrounded by residential buildings, tells you that the planning of that thing was not ideal.
Hakukuwa na any intention of protecting the environment or the society around them, but only to make millions, only to make money. To M's ndo ilikuwa kwa akili yake.
So tukicheki hii, now this is an emergency thing. If these people goes to hospital, majority of Kenyans right now, there are many ways you can finance healthcare in Kenya. You can finance healthcare through out-of-pocket payment, where you fork out your own cash. That is the most common means. Then you can also finance healthcare through insurances. And under insurances, there are private and public healthcare insurances. We will not look into the private sector. That is a whole other discussion.
Before you go into the private sector, and in the concept of insurances, when this bill thing, SHIF transition was being mentioned, it was put in a poster asking for public participation. And then I saw a comment down there. This guy practices in the UK. He says, we are all governed under the NHS in terms of health. So anything health related, NHS. Whether you are a broke member, whether you are a rich member, whether you are a parliamentary to high office in the government, like the quality of care and the standard of care is standardized to a sense that wewe kama MP wa Busia ama wapi, just for me as an example, yeah? Ukikuja, let's say, Nyeri level 5, utapata the same treatment na one of the street urchins chokora amechukuliwa, got sick, ama he was found unconscious akaletwa, you'll still get the same service. Question is, yes, it's a question, maybe to raise discussions on this NHIF, SHIF transition. Will it be able to do the same thing?
But maybe people don't know what exactly SHIF is. So we have to look at this public health care. NHIF is a body that has been there for a very long time. And under NHIF, it's a source of funds where people are contributing certain percentage into a pool, and then money is again used. Once the money is contributed into a certain pool, it's used to disburse people's health expenditure. If you look at it in the way it is right now, it has a ceiling to how much you can pay and how much everyone can pay. The minimum anyone can pay in a month and the maximum you can pay in a month. Now, in October last year, there were 4 bills that were passed into law. And one was something called the Facilities Improvement Act, which is current existing facilities, a fund is created for them and they be improved. Second one is the Primary Healthcare Fund. And this is where now the president rolled out this community health providers. We will look into it. These community health providers are people who will be going deep into the machinery. They do not have their medical background is not all that, but they can be the first point of contact of screening of patients, knowing whether these patients need to go to hospital or not. If you look at it in terms of medicine, we say prevention is better than cure. So in my opinion, I think that is a very brilliant move by the president and the ministry, the cabinet secretary as well. And that 10 years down the line, we will have prevented or reduced the disease burden through these community health providers. Its effect, you're not going to see it now, but you're going to see it later down the line.
Which has started.
Yeah.
We'll discuss more about it.
No. Then now you have the Social Health Act, which now has these 3 fundings. Initially, NHIF was 1 fund, but now you have 3 funds. You have the Social Health Insurance Fund, you have the Primary Healthcare Fund, you have the Emergency and Chronic Diseases Fund, which now these people who end up, that this accident that has happened in Embakasi, these are people who will have benefited from the Accident and Emergency Fund. So, and then you have the Digital Healthcare Fund as well, or digital healthcare programs. Now, how much are we going to pay to SHIF is 2.75% of your income, either as a person who is salaried or household income if you are not a salaried individual.
Mm-hmm.
In this new model, the least someone can pay is 300 shillings. The most someone can pay is 2.75% of your salary. So there's no cap. So if you're earning $1 million, 2.75% of it, let's say 227K 500.
So it's just earnings.
Yes.
They won't look if you have business, how much you're getting from the business also. That counts.
They're going to talk more about how it has to go through public participation before again they change these regulations. Because this is what the stage it is at right now. Because the Shapita, NHIF is dying. There's not going to be NHIF fund, it's going to be dead. And it's only going to be Social Health Insurance Fund, the Chronic Fund, and the Accident and Emergency Fund. So then the issue now comes, is it good for us as Kenyans, this healthcare funds down the line right now and later on, in terms of how much we are being deducted and how much is going to, how is it going to benefit the Kenyan population down the line?
And how are they going to implement whatever policies they want to pass in health service delivery?
I think with regards to that point, I think it is a test of Kenyans, how should I say it, ideology, thinking, generosity. Because wale wako na pesa, they'll pay more. Hawana, they'll still get the service. Will you feel the pain of paying consistently while not not everyone will need to use the nini. Maybe occasionally you get. That's when you go claim your insurance kusimamia. But those people who are in need, they will be kind of benefiting from you in a way, since they are not in that group of being able to pay for themselves.
There are those people who are not capable totally, who are not able to pay totally. The government will be take care of them. The indigents, the government will take care of them. But if you look at, it's a more of like an equitable way of financing it rather than an equal way of financing it.
True.
Yeah, that is the same thing as the housing levy, because now there are 2 levies that are going to be coming in. The 3%, 2%, 5%. So moja imekatazwa, but moja is still
Imekatazwa.
But our president Zakayo has said the law courts will answer to him, not the other way.
Yeah, but if you look at this now, SHIF, are you guys, because this is when the ministry needs public participation, and you as healthcare providers and people who are in someone who is in a policy making decision, what do you think about this model of funding or model of financing healthcare in our country?
We have started from the ban, so let me start there. Then come now to that place. It's sad that what happened to our fellow Kenyans the other day, it shouldn't have happened. It's something that could have been avoided. What do we say? Tumesema we're not discussing about a lot, right?
Just go.
It's sad. It's sad. And I think this should be a wake-up call that let's do things how they're supposed to be done. Let's take care of each other. And by taking care of each other in Manisha, we care about our neighbors. So if we see vitu tu hazifai kufanywa vile zinafaa kufanywa, then let's not do it. Because I think this is an epitome of negligence and negligence.
And someone should be held responsible for that fire.
We are really waiting for that. Personally, we are waiting. Me personally, I want to see.
We've seen the fire. Is it going to end at the fire happened? Or who caused the fire? Who allowed that plan to be in place? And what are the repercussions?
Really, that's something that I hope we're going to see. Because let me just speak about Mama Lucy kidogo. The weight of the patient fell in that institution. And I'd say that, and still something that I also don't like is when something as serious as that becomes a political ground to play with. Because I think Mama Lucy, as it is right now, really came strong in supporting this
ready
patient.
for it.
Yeah, they were ready. They were prepared. Because as I was telling you, there's some units that were being secluded for other things, and I think, and also since the new board came in place, a lot has changed. And when these patients came, and I think this should be an example of how we should be ready for such emergencies. Because each and every patient was taken care of, and the drugs were there. Who said
Your story
madawa ziko, that's propaganda. And that's why, and inatumika kama a political ground. Yet these are people's lives that we are talking about. The drugs were there and people were treated. And one thing I'd say about the funding part of those patients is that now the governor waived.
Yeah,
the bills were taken care of. Not even one patient paid a cent on matters. Hiyo mambo ya kuchomeka. But now coming to this social health insurance fund, on paper is a very, honestly, it's promising, right?
Yeah, everything on paper about this government has always been okay.
Because that's one of the hugest cons of the SHIF. Implementation of those policies and follow-up of the financial implications. Like watu wasai wamesema wata upgrade hospitals. That's the first thing. Those new upgraded hospitals need staff. How are those staffs going to be employed? How are they going to be paid?
Yeah.
And the projects...
Will you pay money to get that job for you to work in that hospital again?
Very serious questions.
Yeah.
Serious
Very
questions.
serious questions.
Because that SHIF, it's a national plan, but healthcare is not nationalized. Healthcare is devolved.
Yeah. That's what I'm saying.
No, the funding bit of it is under a body, a social health authority that is headed
It's
by
independent.
yes,
It's an independent.
yeah. So here, I think they will not. The financing bit of it will not be devolved like.
Even before we go to sexual SHIF, let's look at how NHIF was before. There's something you mentioned. Which country was that?
UK.
That the quality of care you get in one place is the same.
Standardized,
It's
yes.
standardized. We have been practicing, and you'd say even NHIF wasn't like that. Let's be frank, right? The person who was paying 500 bob, and the person who was paying more, they wouldn't get the same service.
Just to mention, in NHIF kulikuwa na
They
civil
were-
servants,
Exactly.
kulikuwa
Kulikuwa na civil servant types sijui ngapi.
kulikuwa na ya watoto edu afya,
Which was
and ukiangalia unasema z
the-
no, you can't do anything. I'll tell a sad story. Kijana with that card edu afya, who needs like good investigations done so that you can actually find out it's acute abdomen, so you need to know what it is. The limit that
What is acute
has
abdomen?
been, acute abdomen, I don't know how to say it in English.
It's a surgical emergency.
But it's a medical emergency where kuna shida ya tumbo. I'll try to put it in that simplistic way. And then you'd want to do more for these patients, but you look at how the cover is like, and you say, nianze wapi? Nianze wapi? And eventually, yes, they figured it out and they managed to sort out his condition. He was actually having a colorectal CA
How old was the
How
boy?
old?
around 18.
Oh, that's too young.
Yeah.
Yep. So ukiangalia again, social health insurance fund is coming again with the bit of chronic conditions, where these diseases will always require money from you over and over and over again. So looking at the people with chronic conditions like cancers, diabetes, hypertension, all those conditions, first of all, getting to diagnose them or being told you have this condition requires a lot of money. Yeah.
Some people,
Yeah, a lot of money because you need investigations, you need a specialist. Then from there, you need medications or you need a procedure. Then from there, you need follow-up. No. So NHIF never covered for that.
It covered maybe 60% of that.
Yeah. But it didn't cover for it as well as SHIF is proposing.
It's
It's promising to cover.
Yeah, and one thing about SHIF we discussed even with Dr. Wanda is that they are also implementing how you diagnose the disease with imaging, with blood works.
Yes,
so
they're gonna
diagnosis
pay
for
for that.
cancer is going to be a bit cheaper than it was.
It will be less.
Yes.
my concern comes to, and I'm also trying to understand more about SHIF as much as I'm also in the public participation. Keep in mind that the deductions are less than NHIF, right? And look, let's come even to the common wananchi, who the limit unaweza toa ni 300 bob. NHIF tukora toa 500 bob, which was not as broad as it should have been. Probably help me understand how,
Like in this point
where now it's been broken down into three sectors, which is being paid less.
So if I was paying 500 in the last one and I'm now paying 300 means imeshuka chini.
Yes.
That will not affect the total contribution in that. Initially, if I had a salary of 100,000 and I was paying 2.75%, I was paying and I was only paying 1,500. If I had a salary of 500k, I was paying 1,500. If I had a salary of $1 million, I was only paying 1,500. Unapata?
Oh yeah.
But now if I have a salary of $1 million, I'm paying 27.
Nimepata. Oh yeah.
It's
It's
your gross,
what you're
your net,
getting.
your gross.
Yeah.
From your gross.
Yeah. So kutakuwa na hiyo bit. Now, this is out to the public. We've just talked a bit about what do you think about this social health insurance fund? Tell us in what you're thinking about it, what your view on it in the comments. And also, would you be for it or against it?
I
So,
think this is something that we should keep discussing.
Yeah.
As it will come as a mirror of public participation.
Yeah, because we are the public members, we're in healthcare.
We'll have to do a part 2 so that
Yes.
we can
Yes.
judge the government's progress.
Yeah.
And see
We'll
what
track
our,
the progress.
our
We'll be
audience
the
has to
tool.
say.
Yeah,
track
definitely. The one thing before we finish, the Doctors Council Secretary General Levy Atela came out strongly rejecting it, and his reasons are the following. Number one, doctors are not going to be covered anymore, and it means doctors in Kenya are not able to afford services they are offering. Number two, it means he said that NHIF has a balance of 11 billion that was not utilized, and this mode of funding is going to create more funds. We didn't even utilize the 11 billion left, and you want to collect more money.
Country of collecting. We're just collectors.
Tunaokota tu.
Venye inatumika lakini hatujui. That's the painful part.
So also the Doctors Council was also questioning the implementation of bit of it. So this is still a matter that is in the cooking. It's not yet done, and this is public participation. So hopefully the Social Health Authority leader, his name is Dr. Timothy Alweni, someone who has had over 20 years experience in healthcare financing. He's the one who's heading this project, and he's a brilliant mind. That's why one of the things that is actually giving me hope about it is the fact that such a person is behind it.
But did you see that video on Twitter of that? There's this doctor that was, I think, on Citizen. What was he talking about? There's something he mentioned in the comments. People were, huyu alikuwa daktari. I don't remember.
The MP.
Yeah.
The MP, you know, he's representing like interests
he
of the
became political,
government.
yeah.
He's no longer neutral.
So that's the problem when doctors get into politics. They are not the greatest representation. Sai kwanza kina Boni Khalwale and that guy. Like, I hope that he sticks to the morals and the ideals of giving back to the public from the points of view of what he saw NHIF wasn't giving to the public at that time.
Would you term these doctors who do this as betrayers of the oath?
Yeah, they're sellouts.
I don't think so. Anyway, I think that has been it from us. We will not be talking much about it, but we will definitely want your feedback. Tell us, how do you pay for your healthcare? What modes of insurance do you use, or which type of insurance do you use? Are you in the public? Are you paying for NHIF and having an extra insurance cover? Or when you mtu hauna insurance kama mimi unatembea tu? Yeah. And you just pay out of pocket.
NHIF me I'm in text. Hujatulipa wewe.
What's your take on as a member of the public? We need an opinion from you guys to contribute. Tell us, do you think this is a good idea? Do you think it's not? I think from our audience's perspective, we can
personally, I think it is a good idea. Personally, I would go for yes.
It's a good idea with one specific point. As a doctor, or as a nurse, as a midwife, as a
healthcare worker,
hata yule anasafisha nini compounds, all those 4 cadres are at risk of contracting any disease in the hospital. Okay.
Even the chronic ones. These people's healthcare insurance should now be prioritized in a way that huyu jamaa hataumizwa, and if he does get sick, yes, atalipa kitu, yes, but if he does get sick, he's among the people who know, yes, I got sick and yes, I was served. Not I served people and I'm left to rot.
Yeah.
You can't afford the service.
Now the healthcare workers not affording the services. So anyways, guys, thank you for tuning in. That was it from us. Please look into our socials, like, share, subscribe, tell a friend. We are Kenyan. Yeah, you have something.
We have not talked about the community
health providers.
Yeah.
And what there's not much to be mentioned about them because they're already rolled out and they're actually doing their work. And in my opinion, that's a brilliant idea. And like the efforts, the fruits are not going to be seen now.
No, that is what I wanted to correct you.
Okay.
The fruits are being seen even now.
So you guys already see.
Let me tell you, like, now a perfect example is what has just happened right now. Do you know the CHPs are the ones who they're the first contacts of these patients?
Yeah.
And they have done, let me just say, the fact that we have CHPs now, I think the casualties, we have not had a lot of casualties with this fire. Okay, they were there, but we have not had a lot. In Mama Lucy, actually, we had none.
Okay.
And it's because of the promptness of these people.
By casualties, you mean like they succumbed to death because of the accident?
Yeah. And I'm saying in Mama Lucy, we didn't have any as at now.
Okay.
As we're shooting this.
Let me ask you one personal question.
Let me
finish. Okay, sorry.
And it's because the CHPs, wale watu wenye kwa ground. And let me say something also. You see, I'll give a statistic. When we started when I came to the board, there were some diseases that were flagged, especially in the Eastlands region, where we say vitu kama GE, we even had some mortalities. And when we know
tell the people GE full not GE labda ingine.
GE is gastroenteritis. It's a disease that inashika watoto and they vomit and diarrhea, right? Peer adults. Yeah. So unapata when these things are flagged, as a doctor you won't go to the community and treat them, but the CHPs will be able, one, to educate on matters that will curb that. Prevention is better than cure, right? And as at now, we can record a decline, especially in PIDS. Now, the numbers of patients, which that is a success, right?
You have to give credit to the president's administration. Although we always like say criticize.
And which I'm thinking that as we continue, this is a very when adapted. When things are on paper, they're really nice, but on the grounds are kind of tricky, right? But I'd say this is one of the things that the government has really put at the forefront, and change is coming. Yep. It's happening, but I think it's even going to be bigger and better once.
Like you said, ufupi na urefu ni maumbile. Kitambi na mimba.
Bidii.